Picture a man with stage 4 prostate cancer, right? And it's metastasized to his bones.
Oh, wow. That's incredibly painful.
Beyond painful. I mean, the pain is so excruciating. He's been to the ER like 5 separate times just to manage it. He is basically running out of all standard medical options.
Which is usually the point where things get really bleak, Just
Yeah.
lying in a sterile hospital bed.
Exactly. Harsh fluorescent lights hooked up to a slow IV drip.
Yeah.
But instead of that, his doctors have actually arranged for a dedicated driver to take him out for an afternoon at a local casino.
Wait, a casino like roulette and slot machines?
Yes. Today, we are looking at a clinic that is, honestly, completely rewriting the rules of oncology, where a trip to the blackjack table is considered a vital part of the healing process. Welcome to the PlacidWay Pulse edition of our deep dive.
It sounds completely contradictory to literally everything we associate with severe illness.
Right.
Because when you are standing on that terrifying precipice of a severe diagnosis, the expectation is suffering. You expect sterile rooms. You expect toxic chemicals. But what we're looking at today is this massive shift in how cancer is being approached. And it's happening specifically just like 25 minutes across the U.S.-Mexico border in Tijuana.
Yeah, we are unpacking the Immunotherapy Center, or ITC, founded by Dr. Carlos Bautista. We're going to explore how they are combining highly advanced immunotherapy with alternative holistic treatments.
Which is such a fascinating blend.
It really is. And the goal for you listening today is to understand the actual science behind this. We're going to look at why millions of medical tourists are seeking out this specific blend of care, the economics driving that choice, and how these treatments actually work on a cellular level.
And crucially, doing that without getting lost in all the confusing medical jargon.
Absolutely. So let's start with the primary medical tool drawing people to Mexico in the first place, which is immunotherapy. Because before we can grasp why the Mexican clinics are different, we really need to understand this biological approach.
Right, and to really understand immunotherapy, you kind of have to contrast it with the traditional standard of care, which is chemotherapy.
The old standby.
Exactly. Chemotherapy is, it's an outside-in approach. You're introducing a highly toxic synthetic chemical into the body to eradicate the disease.
Right.
But the fundamental flaw of traditional chemotherapy is that it targets all fast-growing cells. It simply cannot differentiate between a rapidly dividing cancer cell and a rapidly dividing healthy cell.
Which means it's hitting everything, your hair follicles, the lining of your stomach, your bone marrow.
Exactly, which completely explains the severe nausea, the hair loss, and just that absolute crushing exhaustion patients experience.
I mean, it's basically like dropping a bomb on a city just to stop a few criminals.
That's a great way to put it.
You might get the bad guys, sure, but you're completely damaging the entire infrastructure in the process.
And, the immune system itself is a huge part of that infrastructure.
Yeah.
Chemo often just decimates the very white blood cells you need to fight illness.
Right, which leaves you so vulnerable.
Exactly. So immunotherapy flips that paradigm entirely. It is an inside-out approach. Instead of using a foreign toxin to attack the cancer, immunotherapy uses biological agents to train or boost the patient's own immune system.
So it can recognize and destroy the cancer cells naturally.
Yes.
Okay, so if traditional chemo is the bomb, immunotherapy is like giving the local police force high-tech facial recognition glasses. So they only target the criminals and leave the rest of the city completely untouched.
Yes, exactly. And let's actually look at how they build those glasses from scratch at clinics like ITC. One of the most fascinating methods they use is the creation of custom vaccines.
Wait, vaccines? I thought vaccines were just for preventing things like the flu.
Usually, yes. But these are dendritic cell vaccines. It's a vaccine created to fight an active disease. So what they do is they draw the patient's blood and isolate specific white blood cells called monocytes.
Okay.
And in a specialized laboratory, they culture these cells and expose them to proteins taken directly from the patient's own unique tumor. Oh, wow. So they're essentially introducing the immune cells to the specific protein signature of the cancer, like in a controlled lab environment.
Precisely. Dendritic cells basically act like the intelligence officers of the immune system. Their whole job is to find a threat, take a biological mugshot of it, and present that mugshot to the T cells.
And the T cells are like the foot soldiers.
Exactly. They do the actual fighting. By forcing this interaction in a lab, they educate The dendritic cells. So when those educated cells are multiplied and injected back into the patient, they marshal this highly targeted, super aggressive immune response.
Against just those specific cancer cells.
Right.
That is wild.
Why?
I also read in our deep dive sources that they use medications to remove the brakes from the immune system. How does that mechanism work?
Yeah, so this involves something called checkpoint inhibitors. You see, cancer is biologically very sneaky. It survives by evading detection.
It hides.
Exactly. Healthy cells have these proteins on their surface that essentially act as a secret handshake with the immune system. They signal, hey, I belong here, don't attack me. Okay, that makes sense.
But many cancer cells actually mutate to express those exact same proteins, like the PD-L1 protein. So when a T cell approaches, the cancer cell performs the secret handshake, and the T cell just moves along.
Oh, man. So cancer's literally wearing a disguise.
Yep. So checkpoint inhibitors are medications designed to block that specific handshake. They bind to those proteins, effectively ripping the disguise off the cancer cell.
Wow.
So suddenly the immune system's brakes are off, the tumor is totally exposed, and the T cells can just flood in and destroy it. And because this approach is so specific to the tumor's mechanics, it preserves the patient's healthy tissue.
And their day-to-day energy, right?
Exactly.
Okay, so we have this highly targeted, high-tech weaponry happening in specialized labs. But that brings us to the next massive piece of the puzzle.
The holistic side.
Right, because if immunotherapy is this brilliant targeted weapon, why do these Mexican clinics focus so heavily on alternative therapies? Like in our sources, we see patients getting custom organic meals and sitting in heat chambers.
It does seem a bit out of place at first glance.
Let me play the skeptic for a second, right? If I am facing a severe diagnosis, changing my diet and sitting in a sauna sounds like a trendy wellness retreat, not serious oncology. How is a sauna going to fight a tumor?
I get that. I mean, it sounds completely counterintuitive until you look at the underlying cellular environment. This brings us to the whole philosophy of integrative oncology.
Okay, break that down for me.
The core belief is that you cannot just treat the disease. You absolutely must treat the host. If a patient's body is severely malnourished, highly acidic, or just full of toxic debris from previous rounds of heavy chemo,
It's a hostile environment.
incredibly hostile, even the most advanced, lab-educated dendritic cells are going to struggle to operate in a broken environment like that.
You have to prep the battlefield.
You have to prep the battlefield. Let's take your sauna example. Medically, that's known as hyperthermia therapy. They safely heat the entire body or a specific tumor site.
And what does heating it up actually do?
Well, to understand why this works, you have to look at the vascular structure of a tumor. Healthy tissue has this beautifully organized network of blood vessels. When healthy tissue gets hot, the blood vessels dilate, blood flow increases, and the heat is dissipated.
You literally just sweat it out.
Right. But cancer tumors, they build chaotic, disorganized, and highly inefficient blood vessels. They simply cannot dissipate heat.
Oh, wow. So when you raise the body temperature, the healthy cells just cool themselves down naturally, but the tumor cells trap the heat.
Yes, and that trapped heat causes severe damage to the cancer cells. It literally degrades their cellular membranes. The cancer cells become weak, sluggish, and significantly more vulnerable.
So then when you deploy the immunotherapy, those educated T cells, they're attacking an enemy that has already had its defenses melted away by the heat.
Precisely.
That makes perfect sense. The sources also mention a heavy reliance on oxygen therapies, specifically ozone and hyperbaric oxygen treatments. What's the biological mechanism happening there?
So this is all about altering the biological terrain of the body. Cancer thrives in a very specific environment, low oxygen, highly acidic conditions.
Right.
By flooding the body with medical-grade oxygen and ozone, you are actively destroying the very environment cancer needs to survive.
It's like turning on the lights for cockroaches.
That's a pretty good analogy. Ozone therapy, in particular, introduces an unstable form of oxygen that creates a mild, controlled oxidative stress in the blood.
Okay. And healthy cells can handle that.
Yes, healthy cells have antioxidant enzymes that easily neutralize this stress. But cancer cells completely lack those enzymes. So the ozone essentially acts as a toxic compound to the cancer while simultaneously reducing systemic inflammation in all the healthy tissue.
It is so fascinating that the exact same treatment acts as a shield for healthy cells and a sword against cancer cells.
It really is.
And what about the food, the metabolic and nutritional therapy? Because our sources highlight these highly customized, super strict organic diets.
Yeah, to understand the diet, we actually have to look back at the Max Gerson legacy, which is a massive part of Tijuana's history as a medical hub.
Right, the Gerson therapy.
Exactly. Decades ago, physician Max Gerson pioneered this idea that strict plant-based detoxification could heal the body. Today, we understand the cellular mechanics behind why that works, largely due to something called the Warburg effect.
Named after Otto Warburg, the Nobel laureate, right?
Yes, exactly. Warburg discovered that cancer cells metabolize energy completely differently than healthy cells do. Healthy cells use oxygen to efficiently convert food into energy.
Okay.
But cancer cells, even when oxygen is present, prefer to use this incredibly inefficient process called fermentation. And that process requires massive amounts of glucose, sugar.
Ah, so cancer cells are essentially sugar addicts.
Huge sugar addicts. They need it to rapidly divide and conquer.
So the dietary protocols at ITC, they aren't just about, eating healthy. They're essentially weaponized diets.
They are meticulously engineered to starve the cancer. By removing all the specific refined sugars and carbohydrates that the tumor relies on and flooding the patient with intense organic, plant-based nutrition, you're cutting off the enemy's supply lines.
Wow, rebuilding the patient's healthy cells at the same time.
Right. You are drastically reducing the body's overall toxic load.
Okay, so when you put all this together, the hyperthermia, the ozone, the metabolic starvation diets, you are creating an environment where the high-tech immunotherapy can just thrive.
Exactly. It allows the doctors to be incredibly aggressive with the biological therapies without destroying the patient's quality of life.
Man. So now that we understand the deep science behind this combination, I think the obvious question for anyone listening is, why Tijuana?
Right.
Why is this global epicenter of integrative oncology sitting just across the U.S. border?
Well, part of it is just pure logistical geography. Tijuana is located roughly 25 minutes from the San Diego International Airport.
Which is super close.
Very close. And for patients traveling from across the U.S. and Canada, many of whom are, quite frankly, very frail, accessibility is paramount. Clinics like ITC actually have dedicated shuttles that utilize special medical lanes at the border.
Oh, that's smart.
It creates this totally stress-free, seamless transition directly from the airport straight to the clinic doors.
But medical tourism isn't just about a short drive, right? The real driver here has to be the regulatory environment.
Oh, absolutely. The regulatory differences are the defining factor here. In the United States, the FDA approval process is notoriously rigorous, incredibly slow, and astronomically expensive.
Yeah, it can take over a decade and billions of dollars to get a single drug to market.
Exactly. Furthermore, the U.S. system is structurally biased toward testing single variables. They want to test one specific drug against one specific disease to isolate the exact effect.
Which makes sense for scientific data, but...
But integrative oncology, by definition, uses a dozen different therapies simultaneously.
Right, because if you're trying to save a life, you don't really care which specific therapy did the heavy lifting as long as the combination works. But you can't easily run a standard FDA clinical trial on a constantly adjusting combination of heat, diet, ozone, and custom vaccines.
Exactly. You just can't. Mexico's federal health authority, COFEPRIS, operates with a fundamentally different philosophy regarding a patient's right to try.
Right to try, meaning they have more freedom to choose their care.
Yes. They allow licensed physicians to utilize therapies that have already demonstrated safety and efficacy in other advanced medical systems around the world, particularly in countries like Germany and Japan, which are honestly decades ahead in alternative oncology.
Wow. So this gives patients in Tijuana immediate access to life-saving cutting-edge options without having to wait 10 years for domestic approval in the U.S.
Precisely. Which perfectly explains the origins of the Immunotherapy Center in the first place. Dr. Carlos Bautista didn't just invent this model out of thin air.
Right. His motivation is rooted in profound personal tragedy, isn't it?
It is. Dr. Bautista watched his own father suffer terribly through the devastating side effects of harsh conventional treatments. And that experience really pushed him to look beyond the standard medical map.
That makes total sense.
He traveled extensively to Germany to study these advanced integrative protocols and brought them back to Mexico. He wanted to build an environment that healed the body without torturing the patient in the process.
And we absolutely have to talk about the economics of this, because the financial contrast is staggering. Our sources indicate that a comprehensive 3 to 4 week inpatient program in Tijuana,
Which includes everything, by the way.
right, the alternative therapies, the custom immunotherapy vaccines, the room, daily organic meals, all of it costs somewhere between $18,995 and $35,000.
Which sounds like a lot until you compare it.
Exactly. For anyone who has dealt with the U.S. healthcare system, those numbers are almost unbelievable. In the U.S., a single course of certain immunotherapy drugs, just the medication alone, can easily exceed $100,000.
Oh, easily.
So why is the price tag in Mexico so much lower? Are they cutting corners on quality?
Not at all. If you look at the operational data, it has absolutely nothing to do with cutting corners or lowering the quality of care. The price disparity is driven by structural economics.
Like overhead costs.
Exactly. First, you have significantly lower administrative overhead and facility costs in Mexico. Second, the global pricing structures for pharmaceuticals are vastly different outside the U.S. But honestly, the most important factor is the pricing model itself. Tijuana clinics utilize transparent, bundled packages.
Meaning when you check in, you know exactly what the total cost is. You aren't getting a randomized bill 6 months later charging you like $40 for a single aspirin or $200 for a routine blood draw.
Precisely. The fragmented, completely opaque billing system in the U.S. has led to a documented medical phenomenon that oncologists now literally refer to as financial toxicity.
Financial toxicity, that is such a heavy term.
It is, because when a patient is lying in a hospital bed, absolutely terrified of losing their home to bankruptcy, that extreme psychological stress actively harms their physical health. The bundled, transparent pricing model in Tijuana is specifically designed to eliminate that financial toxicity from the healing equation entirely.
And when you remove that financial toxicity, when a patient isn't calculating the cost of their survival minute by minute, it fundamentally changes their mental state.
It's a huge burden lifted.
And it turns out that mental state is actually a biological variable. Which brings us right back to Jack Conkey, the patient we talked about at the very beginning of the deep dive. Let's move from the macro-level logistics to the micro-level human experience.
Right. Jack arrived at ITC with stage 4 prostate cancer in his bones. The pain was agonizing. But over the course of his stay, he received 12 different concurrent therapies, which he actually described as entirely painless.
And then we had the detail about his dedicated driver taking him to local landmarks and the casino.
Yes.
And earlier we asked why a casino trip is part of oncology. So let's actually look at the biology of that.
It all comes down to the endocrine system. We know definitively that chronic psychological stress elevates the production of cortisol, which is the body's primary stress hormone.
Okay, and what does cortisol do to the immune system?
High levels of cortisol act as a direct immunosuppressant. It literally turns off the T cells that the immunotherapy is trying so desperately to activate.
Oh, wow. So if you're stressed, the expensive immunotherapy literally cannot work.
Exactly. By getting Jack out of a sterile hospital room, allowing him to feel like a normal human being having a fun afternoon playing roulette, they were actively suppressing his cortisol levels.
That is mind-blowing.
Keeping his stress low was a physiological requirement for his immune system to actually function.
It's profound, really. The joy and the normalcy are literal medicine. And the sources from our deep dive are just full of these stories. There's Sadie Latosky, only 19 years old, diagnosed with Hodgkin's lymphoma.
Yeah, Sadie's story is incredible.
She arrived dealing with severe chest pain and struggling to breathe.
You can just imagine the absolute terror of a teenager facing that reality. But the patient accounts consistently highlight the atmosphere of these clinics. It's described as family-like, welcoming, and just deeply empathetic.
Yeah, Sadie wasn't treated as a diagnostic code on a chart. She was enveloped in this supportive environment, and within 3.5 months of integrative treatment, she was entirely cancer-free.
It's just amazing.
We also see the story of Debbie Halper, who had a rare form of liver cancer. Conventional doctors told her it was incredibly hard to treat. She travels to ITC, engages with this multi-pronged integrative approach, and sees her liver cancer clear up in just 6 weeks.
6 weeks. It's truly a testament to treating the whole body.
When you look at the structure of these clinics, they're operating more like healing sanctuaries than medical factories.
And that sanctuary environment, it's actually built into the business model. They maintain incredibly small patient-to-doctor ratios.
So you aren't just a number?
Exactly. Patients aren't seeing a totally different resident every morning for 3 minutes. They have daily, in-depth, unhurried consultations with lead physicians like Dr. Bautista.
That must make such a difference.
It does. This intense focus on clear communication and treating the patient as an active, intelligent participant in their own healing, it lowers physiological stress. It literally allows the body to redirect its energy from panic mode to repair mode.
Wow. So to really synthesize this deep dive into the PlacidWay Pulse data for you listening, we have explored a fascinating medical frontier just across the border.
We really have.
We've seen how clinics in Tijuana are harnessing the incredible targeted intelligence of immunotherapy, teaching the body's own cells to hunt down the disease.
Right, and we've seen how they pair that high-tech science with a relentless focus on the biological terrain. They use heat, oxygen, and metabolic starvation diets to weaken the cancer and prime the immune system.
All while bypassing regulatory gridlock to offer immediate, bundled, and deeply compassionate care.
Yes, it radically shifts the perspective on what fighting a severe illness actually has to look like. It just doesn't have to be this dark, toxic descent.
It doesn't. It offers a genuine alternative.
It really does. And, if we look closely at the science we've discussed today, it leaves us with a pretty compelling question to think about.
Ooh, okay. What is it?
Well, if truly effective, life-saving healing requires treating the entire host. Managing our cortisol levels, optimizing our cellular oxygen, controlling our glucose intake, and constantly supporting our natural immune defenses rather than just waiting to attack a localized disease.
Right.
What does that mean for how you and I should be managing our everyday foundational health long before a crisis ever strikes?
Oh, wow. That is a brilliant thought to carry forward. Healing the host shouldn't just begin when we get sick. It really should be how we live every day.
Absolutely.
When the standard medical map ends at a cliff, it is incredibly comforting to know that science, empathy, and a deeply holistic approach are out there building new bridges. Thank you for joining us on this PlacidWay Pulse deep dive. Keep asking questions, keep looking for the why behind the medicine, and take care of your whole self.